discuss here through the quick revision. Then also high topic of all the subjects will be discussed and most expected topic will be covered in this series. So let's discuss some core feature of Auricle. So in Auricle, we provide live classes for the elevated learning of the student, where knowledge needs interaction. Then also we provide recorded sessions. Recorded sessions are there so that the student will have the access of all the subjects anytime, anywhere through the recorded sessions. The notes are also there, which contain CBME-based question answers, MCQ, and full zone for self-assessment. MCQs are there from beginner level to expert level, which contain standard multiple choice questions. So in today's class, we're going to start with the respiratory system and we're going to discuss both long questions as well as short questions. So in long questions, we're going to learn about the intrapleural pressure and intra-alveolar pressure, and we're going to learn about the significance. Then we're going to learn about the compliance and the various type of compliance we're going to discuss. And in the last, we're going to discuss the factor affecting the lung compliance. Then in questions, we're going to discuss about the non-respiratory function of lung, then respiratory membrane. Then we're going to learn about the factor affecting respiratory membrane. And in the last, we're going to discuss the division of tracheobronchial tree. And also we're going to learn about the division of lungs. So we provide subscription plans starting from basic plan to mentorship plan. Basic plan is of 3 months, standard plan is of 6 months, and mentorship plan is of 12 months. In mentorship plan, we provide all the services like pre-recorded class, live dot clarification, one-to-one personalized guidance, notes, quick revision, examination module. And the mentorship plan costs around 50,000. Also, if you, for instance, 20% discount, you can use my code, that is Dr. Aanchal 20. Also, students can book a slot for personalized counseling session. So let's start with today's topic. And in today's topic, we're going to start with the respiration and we're going to learn about the division of tracheobronchial tree. Okay, so we know that respiration is a process by which oxygen is taken and CO2 is given out, right? And the first breath that take place, that only occurs after the birth. Okay, so if we talk about the normal respiratory rate, so it is different in every individual. Like in the newborn life, it is 30 to 60 times per minute. In early childhood, it is 20 to 40. In late childhood, it is 15 to 25. And in adults, it is 12 to 16, right? Now we know that two types of respiration are there, internal and external respiration. And also, if we talk about the phases of respiration, so we have inspiration and expiration. Now we're going to learn the very important thing, that what is the division of, what is this tracheobronchial tree that we can see. Okay, so as the name suggests, tracheobronchial tree. Okay, so this comprises of trachea and bronchi. Okay, so trachea and bronchi together known as tracheobronchial tree. Okay, so it forms a part of air passage, right? If we talk about the components of this tracheobronchial tree, so look at the components then. So here first we can see we have the trachea. Okay, so trachea is there and trachea bifurcates into two main or primary bronchi, that is known as left. This trachea, this is bifurcates into left and right bronchi, right? So first component we have is trachea. Then next we have the primary bronchus. Okay, so each primary bronchus divides into tertiary bronchus. Okay, so there will be arrival of tertiary bronchus from the primary bronchus. Okay, so means these two, right and left, is divided into tertiary one. These are the tertiary ones that we can see in the picture, right? Then third, that tertiary one will give several branches. Okay, and those several branches are known as bronchioles. Okay, as we can see, these tertiary ones are divided into bronchioles. Okay, and When the diameter of bronchiole become 1 mm or less, it is also known as terminal bronchiole. And the terminal bronchiole continuous or divided into respiratory bronchiole. Okay, so there will be formation of terminal bronchiole and finally from terminal to respiratory bronchiole. Okay, so this is the tracheobronchial tree. Okay, then if we talk about the upper and lower, we have upper part and lower respiratory tract, right? So generally the respiratory tract is divided as upper and lower. Okay, so in upper respiratory tract, it includes all the structures from nose to vocal cord. Okay, and in lower respiratory tract, it includes trachea, bronchi, and lungs. Okay, so this is all about the upper and lower bronchi. Okay, now let's have a look upon the tracheobronchial tree. So we have started it from the trachea, then trachea give rise to right and left primary bronchi. Then each primary bronchus enters lung and divide, right? So each primary bronchus enters lungs and divide. Then secondary bronchi in lungs. Then secondary will give rise to tertiary. Tertiary bronchi will be there in lungs. Then many generation. Okay, many generation of bronchioles will be there. And finally, there will be arrival of respiratory bronchioles. Okay, so this is all about the tracheobronchial tree. Okay, then from trachea to this, there is tracheobronchial. Okay, then from here, there will be arrival of respiratory unit, and that respiratory unit has alveolar duct, alveolar sac, and finally alveolar. Okay, so this is respiratory unit. Fine. Okay. Now another thing we have is respiratory membrane. Okay, so we know that respiratory units start from the respiratory bronchiole, and each respiratory bronchiole divides into alveolar duct, then alveolar sac, and finally alveoli. That already we have seen. Now another thing we have the respiratory membrane. Now respiratory membrane is very important. Okay, so what is this actually this respiratory membrane? So it is a membrane structure through which the exchange of gases occurs. Okay, so it is the medium through which exchange of gases. Just a bit. So from here, there will be exchange of gases occur, right? So we can see that in respiratory membrane, we have a very important thing, that is surfactant, and the surfactant we're going to discuss in today's class in detail. Then we have the alveolar cells, then epithelial basement membrane, interstitial space, and capillary basement membrane, and capillary endothelium. So all these components have a very specific function, and they are very important for the process of respiration. Okay, so this respiratory membrane separates the air in the alveoli from the blood capillary, and it is formed of alveolar membrane. Okay, so it is formed of alveolar membrane. And the respiratory membrane has a surface around 70 square meters and thickness around 0.5 mu. Okay. Now, the about the different component, about capillaries, about cells, we're going to discuss in this unit. Okay. Now, another thing we have that what are the factors that are responsible for affecting respiratory membrane? So, various factors are there like thickness of membrane. Okay. Then surface area. What is the surface area? Then diffusion coefficient is a very important thing. Then partial pressure difference between the gases between the two sides of the membrane. It's a very important factor for affecting the rate of diffusion of gas, right? Then another thing we have the non-respiratory function. As we know that the lungs is responsible for providing the exchange of gases, right? CO2 and O2. Now, is there is any other function then other than respiratory? So, yes. So many functions are there like defense function, maintenance of water, regulation of body temperature, regulation of acid-base balance, metabolism of biologically active substances. Other functions are also there, so that we're going to discuss in detail, right? So first function we have is olfaction. Okay, so olfaction basically receptors are present in the mucous membrane of the nostril that are responsible for giving the sensation. Okay, another function is vocalization. So we know that along with other structure, larynx form the speech apparatus also. Okay, so larynx alone play a very important role in the process of vocalization. So that's why it is also known as the sound box. Okay, then another thing that it prevent the entry of dust particles. Okay, so we know that dust particles enters the nostril from the air. In the surrounding, we have many types of dust particles are there, microbes are there, bacteria are there. So they are prevented from reaching the lungs by the filtration factor or filtration action that is occurs by the hairs that is present in the nasal mucous membrane. Okay, so that does by the hairs present in nasal mucous membrane. Okay. So particle which escape through the protective mechanism in the nose and alveoli that is thrown out by the cough reflex, or if we have any kind of action like sneezing. So in that case, they get if both are also considered as the protective mechanism, both cough reflex as well as sneezing. Okay, so what is cough reflex? It is a modified respiratory process that is characterized by forced expiration. Okay, and it is also, as we have learned, that it is a protective reflex and it is caused by irritation of respiratory tract and also some other areas such as external auditory canal. Okay, then another we have is defense mechanism. Okay, so we know that lungs are important because they play the immunological defense system of the body, right? Immunological defense system in the body, and different function of the lungs are performed by their own defenses and the presence of various types of cells that are present in mucous membrane lining the alveoli of lungs. And these cells are WBCs, macrophages, mast cells, natural killer cells, and dendritic cells. Okay, so some another factors are also there like lungs own defenses. Okay, we know that epithelial cells are present that lining the air passage and secrete some innate immune factor, and those factors are the defensin and catholicism. Right, so these substances are antimicrobial peptides which play an important role in lungs' natural defense. Right, another thing, the defense through leukocyte or through WBC. So the leukocytes, particularly the two leukocytes, that is neutrophil and lymphocyte. So they are present in the alveoli of lungs and provide defense mechanism against the bacteria and viruses. And also we know that neutrophils are those cells which kill the bacteria by phagocytosis, and lymphocytes develop immunity against bacteria. Then last we have the defense through macrophages. So macrophages, we know that macrophages also engulf the dust particles, and also they engulf the pathogen which are present in the environment, and like if they get entered in the respiratory tract, so they engulf the dust particle and pathogen which enter the alveoli and thereby act as a scavengers in the lungs. Okay, so this is all about the defense mechanism. Then another function we have is maintenance of water balance. So respiratory tract play a very important role in the water loss mechanism also. And during the process of expiration, the water evaporates through the expired air, and some amount of water will be lost by the body through this process, right? Then next we have the regulation of body temperature. So what happened during the process of expiration, along with water, heat is also get lost from the body, and the respiratory tract play a very important role in the heat loss mechanism. Then finally, we have the regulation of acid-base balance. And this is a very important function that is performed by the respiratory system. Now, how this all process occurs. Okay, so lungs play a very important role in the maintenance of acid-base balance of the body by regulating the carbon dioxide content in blood. Okay, so that regulation basically occurring through regulating the CO2 in blood. Okay, so we know that carbon dioxide is produced during various metabolic activities in the tissues of the body, and when it enters the blood, the carbon dioxide get combines with water to form carbonic acid. Okay, this is how the whole reaction take place. And this carbonic acid is a very unstable component, so that's why it get dissociate into hydrogen ion and bicarbonate. Okay, so entire reaction is also reversed in lungs when carbon dioxide is removed from blood into alveoli. It can be also reversed. Okay, as carbon dioxide is a very volatile gas. Okay, so it is practically blown out by the ventilator. Okay, and when activities are accelerated, more amount of carbon dioxide is produced inside the tissues, and concentration of hydrogen ion is also increased. Okay, so this leads to reduction in the pH, and there will be increase in the hydrogen ion concentration, causes the pulmonary ventilation. Okay, when more and more pulmonary ventilation will be there, and that will be occurs by acting through the various mechanism, like the action of chemoreceptors in aortic and carotid bodies and in medulla of the brain. So due to hyperventilation, what will happen? Excess amount of CO2 get removed out of the body. Okay, so this is the regulation of acid-base balance. Now we have the another action, that is anticoagulant function. Okay, so we know that mast cells are present. So mast cells in lungs secretes a very important substance, that is heparin. Okay, so heparin is an anticoagulant. It is a natural anticoagulant, and it prevents the intramuscular clot. Okay, so these all are the non-respiratory function of respiratory tract. Fine. Okay. Now next we have a very important question, and usually this question repeats in the university exam in every alternate year. So you should all consider it as a very important question. So the mechanism of respiration, okay? So respiration occurs in two phases, okay? And those phases are inspiration and expiration, okay? So what happened, we know if there will be inspiration, so there will be enlargement of the thoracic cavity. The thoracic cavity will get expand, okay? So thoracic cage get enlarged and lungs expand so that the air will enter inside the lungs very easily, okay? Now, what happened during expiration, the entire process will be reversed. Okay, so the thoracic cavity, the thoracic cage, and lungs get decrease inside. In inspiration, it get increase, and in expiration, it get decrease. Okay, so during normal quiet breathing, inspiration is a active process, and expiration is a passive. It is a active process, and it is a passive. But right now, we are only talking about normal quiet breathing. Okay, now what are the muscles of respiration? So we have two types of muscle, the inspiratory muscles and expiratory muscles. So first we're going to talk about the inspiratory muscles. So inspiratory muscles that are involved in the inspiratory movement. Okay, so in inspiratory muscles we have primary muscles and we have accessory muscles. Okay, so in primary muscles, the muscles like diaphragm is there, which is supplied by phrenic nerve, and we have external intercostal muscle. Okay. Then in accessory muscles, various the muscles are there, like sternocleidomastoid. I hope all the student knows the location of sternocleidomastoid, and its location is somewhere in its name actually. Then other muscles like scalene, then anterior. So these are the inspiratory muscles in which we have learned about the primary and accessory muscles. Okay. Then another thing we have is expiratory muscles. So in expiratory muscles also we have primary and accessory. So in primary muscles we have internal intercostal muscles, which are again innervated by intercostal nerves. And in accessory muscles, we have abdominals. Okay. Now, if we talk about the movements of thoracic cage, okay. So in here we're going to learn about the two movements, the movements of thoracic cage and the movements of lungs. Okay. So inspiration causes enlargement of thoracic cage. Okay. So during inspiration, what will happen? There will be enlargement of thoracic cage. Okay. And the thoracic cage enlarges because of in the all diameter. Okay, all along the diameter through the anteroposterior and transverse and vertical diameter. Okay, now anteroposterior and transverse diameter of thoracic cage are increased by the elevation of lips when the lips get elevated. Okay, and vertical diameter is increased by the descent of diaphragm. Okay, now in journal, whenever there is change in the size of the thoracic cavity, that occurs because of the movements of four units, and those are thoracic lid, upper costal series, the lower costal series, and the diaphragm. Okay, So the thoracic lead is formed by the manubrium, sterni, and the first pair of ribs. So the movements of thoracic lead increases the anteroposterior diameter of thoracic cage, and due to contraction of the muscles, the first rib move upward to more a horizontal position, and there will be increase in the anteroposterior diameter of upper thoracic. Next, we have the upper coastal area. So, upper coastal areas is constituted by the second to sixth pair of lips. And whenever there is movement in the upper coastal series, there will be increase in the anteroposterior and transverse diameter of the thoracic cage. Okay, and in this also we going to see about the pump handle movement and buckle handle. Okay, then another we have is lower costal series. So lower costal series includes 7 to 10th pair of ribs. Okay, and in here we have 2 to 6th pair. Okay, so the movement of lower costal series increases the transverse diameter of thoracic cage by the buccal handle movement. Okay, now what is this bucket handle movement? Like bucket and handle, there will be lower costal series of lips that shows buccal handle movement by swimming outward and upward. Okay, now finally we have this diaphragm. Okay. So the movement of diaphragm increases the vertical diameter of thoracic cage, and normally before inspiration, the diaphragm is dome shape. It is like this structure, dome shape. Okay, and there will be convexity that is facing upward, to like this. Okay, then during inspiration, due to the contraction of the muscle fibers are shortened, but the central tendinous portion is drawn downwards so that the diaphragm gets flat. Okay, now finally we have the another movement, that is movements of lungs. Okay, so what happened during inspiration? There will be enlargement of thoracic cage, and there will be development of negative pressure that is increase in the thoracic cavity. So during inspiration, what will happen? There will be expansion of lungs. Okay, so or during expiration, what will happen? The thoracic cavity will decrease and in size. So there will be decrease in the size of the lungs also. Okay, so the pressure inside the thoracic cage also comes back to the pre-inspiratory level, and it also compresses the lungs tissue so that the air get expelled out of the lungs like this. Okay, fine. Now, next we have the another topic, that is pulmonary surfactant. Okay, so what is pulmonary surfactant? This is a surface acting material. Okay, this is a surface acting material, or we can call it as a agent that is responsible for lowering the surface tension. Okay, this is very important, that it is important for lowering surface tension of fluid. Okay, so surfactant then lines the epithelium of alveoli in lungs, is it is known as pulmonary surfactant, and it is also responsible for decreasing the surface tension. Okay, so it is an agent that decreases surface tension, that is known as surface active agents or surfactant, and surface tension can be defined as a cohesive force of attraction experienced by the molecule that is present in the interface of two media. Right, the surface tension may develop between solid liquid or liquid gas media, and surface tension tends to push the molecules at the interface inwards, thereby reducing the interaction between the two phases. Okay, now very important thing, that what is the source of secretion? Okay, source of secretion of this surfactant. So two types of cells are there. First we have type 2 alveolar epithelial cells, and second, the Clara cells. Okay, so type 2 epithelial cells in the lungs, which are known as surfactant secreting alveolar cells, and these are the cells which are also known as pneumocytes. So please remember the another name of these cells are pneumocytes. Okay, so pneumocytes are there that are responsible for secreting the surfactant. Okay, then another we have the Clara cells, and the Clara cells are situated in bronchioles. Okay, and these are known as bronchiolar exocrine cells. Okay, then if you look at the chemistry of surfactant, so these surfactant are lipoprotein complex. Okay, lipoprotein complex that is formed by lipid and protein. That is why it is known as lipoprotein complex. Okay, so in especially lipids, it is made up of phospholipids, protein, and amines. Okay, then also in phospholipid, a very important component that is DPPC, that is dimethylmethyl phosphatidyl Okay, then in proteins also, we have SPA, SPB, and SPC, and SPD. Okay, so basically there are four surfactant protein that are known as SPA, SPB, SPC, and SPD, and surface protein A, basically surface protein B, surface protein C, and surface protein D. Okay, so both SPB and SPC are hydrophobic, and SPA and SPD are hydrophilic in action. Okay, then another thing, that what is the function of the surfactant? Okay, so as already we have discussed, the main function of the surfactant to decrease the surface tension in the alveoli in lungs. Okay, and this surfactant act by the mechanism like phospholipid molecules are there in the surfactant that has two portions that already we have discussed, the hydrophilic and hydrophobic. Okay, so one portion of the molecule is hydrophilic, and this portion get dissolved in water and lines the alveoli, and the another portion is hydrophobic and it is directed towards the alveolar layer. Okay, then one more thing, that what is the factors are necessary for the formation and spreading of surfactant. Okay, so formation of surfactant required many substances, and formation of tubular myelin requires DPPC, PG, and hydrophobic protein. And what are those hydrophobic protein? These are SPB and SPC. Okay, so this is about the factors that are responsible. Now, another thing we have is the pressure. So we're going to discuss about two types of pressure, that is the intrapleural pressure and intraalveolar pressure. Okay, so two types of pressures are there that are exerted in thoracic cavity and lungs during the process of respiration. Okay, so we have intrapleural pressure, and this is also known as intrathoracic pressure, and intraalveolar pressure, and it is also known as intrapulmonary pressure. Okay, fine. So first we're going to discuss about the sorry. First, we're going to discuss about the intra-pleural pressure. Okay, so this is the pressure that existing in pleural cavity between visceral and parietal area. Okay, so if we look at the lungs, so if this is lungs, okay, so this is visceral and this is parietal. Parietal is towards the chest cavity. Visceral is lining the lungs. Okay, so this is the pressure exerted between the pleural and parietal layers of pleura. Okay, and it is exerted by the suction of the fluids that lines the pleural cavity. Okay, then another one we have is the intra-alveolar pressure. It is uh, intra, right? So it will be like this. Intra-alveolar pressure. So this is the pressure existing in the alveoli in lungs. Alveoli in lungs. Okay. And it is also known as intrapulmonary pressure. So the intrapulmonary pressure, it is a pressure inside the lungs decreases as the volume increases during inspiration and pressure increases during expiration. So as we can see that if we consider 0 as the start of inspiration, so this pressure decreases during the entire process of inspiration and it will come till -2. Okay, and as the process of expiration starts, again it will comes to 0, and during the process of expiration it get increases. Okay, and if we look at the this intra-alveolar pressure, so it starts from -4 during the process of inspiration. So again it get decreases and it decreases till the -6, and again during the process of expiration it will increase and again it will comes to 4. Okay, so this is the intrapulmonary or this intra-alveolar pressure. Okay, now what is the significance of these two pressure? Okay, so if we talk about the significance, so intra-alveolar pressure causes the flow of air in and out, because if we talk about the atmospheric pressure, so it is 760 mmHg, right? Atmospheric pressure is 760 mmHg. Okay, so what happens that the flow of air is from low to high. Okay, so that's why the pressure is going low during the process of inspiration. Now we need to exhale air, so the pressure will increases more in lungs as compared to outside, right? Fine. Now, next we have the another important topic, that is compliance. So, compliance is the ability of the lungs to expand, or it is a compensability of lungs and thorax, and it is defined as the change in volume per unit change in the pressure. Okay. If we talk about the significance, so determination of compliance is useful as it is the measure of stiffness of lungs, and stiffer the lungs, the less is the compliance. Okay. So if we talk about the specific compliance, so we have a formula for this. Specific compliance can be determined by using a formula that we have is compliance of lungs upon functional residual capacity. Okay. Now, if we talk about the types, so we have two types, that is static and dynamic. Okay, so as the name refers, static. Static means static is a compliance that is measured under static conditions. Static means by measuring the pressure and volume when breathing is not taking place. All the conditions are static. Okay. And this static compliance is the pressure requires to overcome the elastic resistance of a respiratory system for a given tidal volume under zero flow condition. Okay. Then second we have is dynamic compliance. So dynamic compliance is a compliance that is measured under dynamic condition, means during regular breathing. Okay. Then already we have learned this formula. Okay. Then if we talk about the variations, okay, so what are the factors that are affecting the patient compliance? So those factors we have is Educational level, psychological level, patient beliefs and motivation, cost of medication, duration therapy, poor understanding of instruction, and adverse effects. Okay. So now, what are those conditions in which compliance can increase, and what are those conditions in which compliance can decrease? So if there is increase in compliance, so it can increase in the condition like in old age, or if the person is suffering from the respiratory disorder like emphysema. And it can decrease during the condition like if there is paralysis in respiratory muscles, and if the condition like pleural effusion is there. Fine. Okay, now the last topic we have is today's class is dead space. And again, the dead space is a very important topic. Usually, it is being asked in the university exams also. Okay, so dead space, basically it is a space or it is defined as the part of the respiratory tract where exchange of gases does not take place. Okay, that's why it is named as dead. Okay, so it is a space where gaseous exchange not take place. Okay, and it is classified as two types: the anatomical and the physiological dead space. Okay, so as the in anatomical space, basically it extends from nose to terminal bronchiole. And it includes nose, pharynx, trachea, bronchi, branches of bronchi up to terminal bronchioles. Okay, so these are the structures which serves as a passage for air movement only, and there will be no exchange of gases. Okay, then another we have the physiological dead space. So it includes anatomical dead space plus two additional volumes. So additional volumes here included in physiological dead space, like in air in the alveoli, which are non-functioning, and in some respiratory diseases where alveoli do not function because of the dysfunction or destruction of alveolar membrane. Okay, so air in the alveoli which do not receive adequate blood flow and where gaseous exchange does not take place. Okay, so this is all about the dead space. So we are done with today's topics. So I hope you find this class more helpful, and also you can connect us with the various platform like YouTube, Instagram, Facebook, Telegram. So thank you so much for watching my class.